In Singapore, almost 90% of out-of-hospital cardiac arrests happen at home and in public areas. In such situation, bystander, CPR and AED plays an effective role in saving the patient through the golden hour. Because for every minute that nothing is done to resuscitate the victim, their chance of survival drops by 10%. If you notice someone who needs help, do not panic. Just remember DRS, A, B, and C. D. Check for danger. Check for danger before approaching the casualty. Make sure that the scene is safe. R is for response. Tap firmly on the casualty's shoulder and check for response.
Hello, are you okay?
S. Shout for help. Ask someone to call 995 for an ambulance.
No response. Priscilla, call for ambulance 995, get AED.
But if you are alone, call ambulance 995 and follow the dispatcher's instructions. A. Ask for an AED. The My Responder app helps you to locate the nearest publicly accessible AED from your location. B. B is for breathing. Look at the rise and the fall of the chest to check for normal breathing. This should not take more than 10 seconds. For healthcare personnel, check for the cardiac pulse and breathing. C. C stands for compression. Start chest compression if the casualty is not breathing abnormally, or when you are in doubt. Kneel with knees slightly apart, interlace fingers, and place the heel of your hand over the lower half of the sternum. Position your shoulders directly above the casualty's chest. Straighten both elbows and lock them in position. Ensure that you compress about 100 to 120 times per minute. Each compression about 4 to 6 centimeters deep. If the casualty is still not breathing, continue chest compression until AED or paramedics arrive, or when the casualty resumes normal breathing. If you are alone at the scene and feeling tired from chest compression, you can take a break for no more than 10 seconds after doing 100 compressions. There are over 10,000 publicly available AEDs in Singapore. You can find them in many public places, and anyone can use AEDs to save lives. Use a solid or sharp object like a key or a pen to strike confidently at the center of the glass on the AED cabinet to break it and retrieve the key. Do not use your bare hands. When the AED arrives, check the area for wet surfaces, metallic surfaces, and flammable gas before you use the AED. Always continue CPR until the AED is ready to analyze. Turn on the AED and follow the voice prompt. Put on your glove, shift any jewelry to the side, roll up the casualty shirt and shave any chest hair. Remove any medical patches and wipe dry his chest, ensuring that the chest is bare, dry, and clean. Apply the AED pads firmly onto the bare chest according to the diagram. One on the upper right chest under the collarbone and the other on the lower left below his nipple. If the casualty has a pacemaker below his right collarbone, you have to place the AED pads 4 fingers away from it. Continue CPR until the AED prompts.
Stop CPR, stand clear.
At this point, ensure that no one is touching the casualty during the analysis. When AED prompts,
shock advised.
Shout.
Stand clear.
Shock delivered. If needed, start CPR.
Continue chest compression after shock is delivered. Second rescuer can take over the chest compression. If AED prompts, no shock advised. Continue chest compressions. Stop CPR only when the AED is analyzing heart rhythm, when the casualty wakes up and regains normal breathing, or when the paramedics take over. Remember, immediate application of CPR and AED can raise survival rates as high as 60%. You have the power to save a life.